All right, welcome everyone. We're Physician Care Services. Just want to start off by thanking our board for taking time out of your busy schedules to come and hear from us today. We're very excited to have you guys. We wouldn't be here today without you. And so we really appreciate all the effort you've put on throughout the years. Recently, we changed our mission. We strive to improve the health of Hillsborough County by providing convenient, affordable, and excellent care.
So thinking, I'm going to try to make it through this. I'm about that close to not having a voice, but I think in order to, provide a true continuum of care, I think you have to take a look at the current situation. Some of the things that are affecting everyone in the county: the Affordable Care Act, aging population, mental health, limited access of care, and also county health. Here we see the majority of residents are insured either by their employer or by a self-insured. Notice that the top line's flat. It's for 1,000+ employees, so I'm assuming since they don't fall into any of the categories that we don't have any employers that big. And this kind of shows the breakdown by income, what kind of coverage you have by income. And most of our uninsured are obviously going to be our lower income. With our aging population, you can see that the largest groups by far are the 25 to 44-year-olds and the 45 to 64-year-olds, mostly in Middleborough and Jasper. We think that this is going to be a concern with chronic care eventually, long-term care, things like that. Looking at the population by city, by gender, we can see that it's pretty even, male, female, in most of the cities, but again, our largest populations in the county seem to be in Jasper and Middleborough. As far as mental health goes, excuse me, currently there's no mental health. The patients usually end up in the emergency department and eventually get shipped off to Capital City. As far as limited access of care, lots of rural areas in the county. You can see by our matrix here that basically most cities are at least 20 to 25 miles away from each other. Some are a little farther. I think one facility, the closest care was 45 minutes, but these are just averages. And you can see our current average population by city over a 10-year trend, and you can see most of them are kind of stagnant except for Jasper and Capital City. Both of those grew by anywhere from 60 to 70%, so this is our growth area. As far as the county health goes, county health department is pretty limited on their funding. They're looking to increase health education, childhood screenings, and there's issues with air pollution and water pollution. So these are all concerns for everyone in the community. They even mentioned that the funding is so low that they may skip some of the years that they do the restaurant inspections. So that's a pretty serious issue. Some of the prevalent conditions in the county: HIV, AIDS, obesity, mental health, again, cancer, diabetes. We see our AIDS patient numbers are declining, but it's still a concern in our county. This is from 2004 to 2014, so they've declined in the last 10 years, hopefully because of some good education, but looks like we still have some issues there. One problem that we did notice is that other STDs are increasing, especially gonorrhea. Obesity is a concern. We feel like obesity can lead to other chronic illnesses, and with our population aging, that can be a burden on the health community. As far as mental health goes, again, just recapping that there's no inpatient. These patients are going to end up in the ED, clogging up the emergency departments and things like that. With cancer, we have large numbers of cancer cases. This is broken down by what type of cancer, the average active cases, and obviously breast cancer and prostate cancer seem to be the highest in the county. With diabetes, these cases are also continuing to rise. We've seen an increase in the 44 to 74 age group, the top and the middle. We've seen a decline in the 75 plus, and really didn't have a good explanation, maybe that they're just dying off.
Because of everything that Scott has just mentioned, we believe there's going to be a demand for there's going to be a substantial demand for health services. As y'all know, the Affordable Care Act is going to provide more people with health insurance. Also, the aging population is increasing. We believe that the city of Middleborough needs to increase their nursing home care and their hospice care. Also, with aging population, there's a possible increase with mental illnesses such as dementia and Alzheimer's. But the aging population also includes chronic care illnesses. With mental health, we believe, because there's an increase in population, because the aging population is increasing, there's a chance for an increase in mental health, especially dementia. Oh, I already said that. Go on. The limited access to care needs to be fixed, or else there will be a continued increase in chronic illnesses. County health problems include pollution and education. And as a company, or as a healthcare provider, we believe that education is important in decreasing the chances for illnesses tomorrow. This is me. In terms of our organization, we strongly believe the ACA will cause a need for service providers. We are in a unique position that we can bridge the gap between primary care and emergency room visits. Our relationship with the local police has been established to bring non-emergent mental health patients to PCS. The decrease in emergency room mental illness visits by treating them as outpatient in our urgent care facilities.
We're going to be opening a third PCS facility in Middleborough. You guys heard about it earlier. It's going to be through a partnership with Hillsborough Community Health System. Megan will actually discuss this later on, but it will require PCS to hire more support staff and medical assistants. There's also a new development project going on in Middleborough. We are going to be opening a for-profit nursing home. Cliff will talk about this venture later on. We are going through some administrative changes. Dr. Tobias needs some assistance running all the PCS locations now that there's a nursing home and a third location. So we are currently going through interview processes to find an assistant CEO, and hopefully we are looking for someone with a background in a CPA. All of our physicians are going to be full-time to meet the demands of our locations and our expansion of hours. All physicians and psychiatrists will have admitting privileges at Hillsborough Community Health System, and this is through our partnership with them. To meet the community demand and the volume that we have seen in our waiting rooms, we are expanding our hours to 7 days a week, 7 a.m. to 9 p.m. This will really help the people who work 8 to 5 and be able to come to us instead of going to an emergency room. Our drug testing services are also going to be changing. We will be giving mandatory drug tests. Drug tests are also going to be required for people who want workman's comp health care and for all new hires in the community. We are venturing into the outpatient specialty pharmacy. It is going to be offered at all 3 locations. We will provide high-volume drugs and specialty drugs that treat illnesses such as cancer, HIV, and AIDS. We are going into the outpatient rehab services, especially for our occupational health. We will provide physical therapy, speech therapy, occupational therapy, and respiratory therapy. Through our partnership with Hillsborough Community Health System, we are venturing into the outpatient mental health. This will help them decrease their ER visits. And in terms of marketing for workman's comp cases, I have a note here that there is a new law that is shifting the responsibility to find a provider from the employee to the employer to treat workman's comp cases. So we are working on a marketing strategy right now to become the #1 service provider for these workman's comp cases. In terms of regional area focus, we focus on the entire Hillsborough County. We have 3 locations, one in Middleborough, one in Jasper, and one in Mifflinville. Outpatient therapy will be provided in all locations along with outpatient pharmacy, mental health, and our nursing home are going to be located in Middleborough. We are targeting a wide array of populations, mainly the community employees. Right now we are the #1 choice for them, but we want to ensure that for the lifetime of our facilities. We are targeting people with scheduling demands. That is why we're staying open later. We're for people who don't have a PCP, who don't want to make an appointment. It's convenient but quality care. We also are targeting the mentally ill in Middleborough and surrounding areas. There's a need for psychiatrists out there. They have counselors but no psychiatrists. Residents in need of pharmacy or specialty drugs, that is why we are here. We're going to be marketing to them, make it convenient for them to come in and get the drugs they need after they get off work. And the elderly of Middleborough and surrounding areas.
Okay. I will be discussing our partnership with the Hillsborough Community Health System. We have entered into a joint venture and co-branding effort with them, and we will be leasing our land from HCHS, their new logo. We will be building a new building on their land, and it's going to be financially equal between both companies. We will provide care so that their ER can kind of clear up and they don't have so much overwhelming flow in. We can take the patients that aren't necessary to go into the ER, as well as taking care of their mental health patients on an outpatient basis. We are going to be switching over to their EHR so that we can just have a better continuum of care. It's kind of happening all over the county, so we can all communicate a lot better. We'll also be using them for our diagnostic materials. They'll provide them in our other 2 locations so we can better equip our locations for our patients. And then they're also going to be providing us OB/GYN care 1 day a month so that we can do like mammograms and things like that, since breast cancer is a very large population in our county. So our collaboration will benefit us because we will be able to get diagnostic materials at a lower cost than we could buy them. We're going to increase our patient volume, and they're going to help us with outpatient specialty pharmacy. We'll get OB/GYN care at all locations, and as well help with all of our therapies. This collaboration will benefit the community by reducing the non-emergent usage and reducing the healthcare costs, as well as providing accessible care to all residents.
So we have the opportunity to partner with the health department to lease the Manor Haven, which we're going to rebrand that to HHS, Hillsborough Health Services. It's a 20-year lease. We're planning on doing renovations for the life of the 20-year lease. The status now financially is not-for-profit. We're going to change it to a for-profit status, but still keep the Medicaid patients that are there. We plan on having a dementia unit. We're in works right now with the health department to possibly maybe doing 15 beds devoted towards that. The nursing home currently is ranked 3-star on Medicare.gov. We plan on bringing that to the 5-star rating within, 3 years. And the 5-year plan is to possibly build another nursing home if we can get the licensed beds. This collaboration will increase the brand awareness of PCS, and it'll also provide us financial benefit for the rising silver tsunami. The collaboration will benefit the community of Middlesborough by providing a safe place and for demented patients and the elderly population, and we are the only nursing home in Middlesborough. By providing this type of service, we'll be able to free up revenue from the health department so they can spend it in other areas that serves the population.
We are really excited about the future of PCS. As you can see, our vision, starting off with continuum of care, we noticed that we were sending a lot of our patients to other facilities for their occupation rehab. And so what we wanted to do was be able to have a one-stop shop, if you will, where they're able to come, have be diagnosed, be able to receive their pharmacy needs. our hours, we're allowing more accessible care to our patients in the community. This was by demand. We weren't doing this. We wouldn't be doing this if there wasn't a demand for it. We're really excited about our partnerships with Hillsborough Community Hospital, Health System, sorry, and what we're going to be able to gain from that venture. Being able to receive new clientele, opening up a third facility, being able to receive those patients in the emergency room that don't need to be clogging that up. And we're also really excited about our expansion especially with these pharmacy needs, being able to provide specialty pharmacy needs for those with HIV/AIDS, cancer, diabetes, to name a few. That's a huge opportunity for us to provide that throughout the community. And as you know, that is a pretty good profit margin on that for us. But and then the other expansion is being able to get into the nursing home. As Cliff mentioned, it is the only long-term care facility in Middleborough, and our lease agreement is for 20 years. We're really excited about that, being able to bring in some new revenue and be able to assist the community by providing great long-term care to the elderly in the community. Questions?
Can you clarify, when you all were talking about drug testing, could you go through that again?
Yeah, of
for
course.
me? I think I didn't quite
Yeah, there's a new labor contract that's actually going to require drug testing for all workman's comp cases. So before you can even get health care, somebody has to do the drug test. And the margins on that are great for us because Dr. Tobias is an MRO, so instead of just being compensated $42, we'd be compensated $65 since he'd be reading our test. And it only takes our medical assistants 10 minutes to do the drug test. So we really wanted to market that. I mean, right now we do it if an employer asks, but now that this new law is going to come into effect, we'll definitely be marketing that, and hopefully we'll be the #1 place. I mean, it's very convenient for somebody to get off work, come to one of our locations, pee in a cup, and get their drug test done, right?
Just one comment on the presentation. Great job, by the way. Did you guys have the vision in front? It was in the beginning of the presentation as well, just towards the end. I wish I had a hard time when you guys were going over that really aggressive expansion strategy about you want to do rehab and all that stuff. Until you hit on that continuum of care thing, I was like, why the hell are they doing all this? Right? But I do remember a piece about the continuum of care at the very, very beginning. But it really would have made a lot more sense and just flowed perfectly if you would have started off with the vision, and then you could have ended still with the vision, said, hey, here's our issues, this is our vision, this is what we did, this is how we fulfilled it. A great job.
I was just going to echo what they said, so same thing. I was kind of lost in the beginning about what the vision was, and so that's all. I just probably moved it kind of places.
And we kind of, I guess, I don't know, the rest of the groups kind of gave them a little more background, whereas we kind of did this presentation more as you guys are our board and kind of already know a lot of these things, so that's, I guess, kind of some miscommunication, I guess, or.
The vision was the objective 4 on our sheet that the assignment. So maybe vision wasn't the right title. But I do see what you're saying.
Right.
We didn't cover the background because that was something that we had done in PowerPoint 1, and I even thought about printing it, but too many slides.
This is a very inactive board. We don't keep up.
Next time, when y'all come for the next quarterly meeting,
I just wanted to check, because y'all were talking about the ACA. Did the state pass the Medicaid expansion yet?
There's no information on that. We're going to say yes.
Good answer. And then, about the outpatient psychiatry patients, what are the common diagnoses that you see in that patient population?
It was something to help with our partnership to reduce their ER, so we were going to try and triage them. If somebody is very emergent, because we have the ER right there, they can come through us. A lot of the times these people are going to be, the local police is bringing them to us. So it's people walking down the street who are probably schizophrenic but are scaring the community. patient meeting instead of them waiting in the ER and taking up their cost. And so because we're right next to the ER, we can kind of do that, because if they need to be stabilized, we can shift them over and they can stabilize them over there. But it is more of the bipolar, the schizophrenia, some of the dementia patients. It's not like the normal depression that you would see in the counseling services.
Just to flip it from the nursing home from a not-for-profit to a for-profit, I don't really follow, like, have you checked with legal in terms of how you make that happen?
Yeah.
What did that entail?
We have an entire law team, a legal team on that. We worked that out. We just wanted to get to the nursing home business because we saw it as an opportunity to increase revenue. So that's when we kind of flipped it to the for-profit status and we finally expanded from there.
But who on your group has any experience in for-profit leadership management?
Well, we're having a CPA pretty soon. He's going to be an assistant administrator and he has 15 years of experience in running nursing homes.
I just have one comment. I thought the presentation was very good, but it also, I think, kind of echoes what your board was saying to you. You're it was a little confusing. You know, you're going in all these different directions and so forth. And it may have been a little bit more beneficial if you kind of maybe laid it out a little bit of what you already have, what are you building on from what you already have, what those synergies were going to be, and then what were the new ventures and product lines you were getting into, what the time frame of that would be, because you can't be all things to all people. Because again, it will also tie into your costs, and are you going to be able to have that capital that's necessary to go into those new ventures and so forth. But you know what, I think as a business, you're really trying to touch on as many service lines as you can. And it goes back to, do you have the expertise to do that, or are you going to have to hire it? So that would be my only comment on the presentation. Well done.
So my one question, somebody mentioned something about providing diagnostic services at a lower cost. How is that gonna work?
Well, we do not have a very good cost of capital in our finances, but HCHS does. So as we partner with them, part of our co-branding and joint venture was that they agreed to help us get that. So just